Hello, my name is Aydogdu, and in this presentation I will talk about our preclinical study which has a title of In vivo examination of prostate to bladder cross-sensitization in a rat model. How does chronic pelvic pain syndrome affect bladder function? We don't have any affiliations to disclose. I will shortly talk about the background of the current study. Most of the male patients diagnosed with chronic pelvic pain syndrome suffer from urinary urgency and frequency, much like patients with overactive bladder. However, the mechanism which gives rise to association between chronic pelvic pain syndrome and lower urinary tract symptoms is unclear. And most of the male patients who suffer from the painful inflammatory diseases of the lower urinary tract rarely experience satisfactory treatments. And defining potential mechanisms behind pelvic organ sensitization will possibly increase the chance to present more effective treatment options for these patients. In the current study, we aim to investigate if chronic prostate inflammation leads to symptoms of bladder overactivity in a rat model of chronic pelvic pain syndrome. Further, we aim to examine potential underlying mechanisms causing these alterations. This is the flow chart of our study, and a total of 24 adult spray-dowler rats were included in the current study, and the animals were divided into 4 groups, as 6 rats in each group. And in the first 3 groups, zymosan was injected into the dorsal lobe of the prostate to create a functional model for chronic pelvic pain syndrome. And in the control group, saline was injected into the prostate instead of zymosan. And after 7, 14, and 21 days following zymosan injection in the chronic pelvic pain syndrome groups, all of the rats were investigated with metabolic cage experiments. And in the control group, metabolic cage experiments were done after 14 days following intraprostatic saline injections. After 16 hours in the metabolic cage, all of the rats were investigated with histometry measurements. During histometry investigations, bladder pressure, residual urine volume, bladder capacity, compliance, voiding time, and non-voiding contractions were investigated. Concentration response series of methacholine and ATP were also investigated during the histometry measurements. After histometry, the prostate and urinary bladder were excised and investigated for potential inflammatory changes using a grading scale in all of the rats. Metabolic cage investigations revealed a higher total number of micturations and more micturations per hour in the zymosan injected rats as compared to controls. Similarly, the volume per micturation was also lower in the chronic pelvic pain syndrome groups as compared to controls. Cystometry investigations revealed more non-voiding contractions in the zymosan injected rats as compared to controls. Similarly, compliance was lower in the chronic pelvic pain syndrome groups as compared to control group. And voiding time was also longer in the zymosan injected rats as compared to control rats. At a dose of 5 microgram per kilogram methacholine, a significantly decreased response was seen in the 14 and 21 days zymosan groups as compared to control group. Likewise, at the highest dose of ATP, the contractile responses in the urinary bladder were significantly decreased in all zymosan groups. There were no significant differences between the groups regarding total prostate weight. Both grade and extent of prostate inflammation were higher in the chronic pelvic pain syndrome groups as compared to controls. Further, the degree of inflammation tended to increase over time. Likewise, regarding the bladder, there was a trend towards increased degree of inflammation over time. The present study strengthens the notion that cross-sensitization between adjacent organs in the pelvic region can explain the common pathophysiology of inflammatory pain syndromes, including chronic pelvic pain syndrome and bladder pain syndrome. It's likely that both bladder pain syndrome and chronic pelvic pain syndrome can be treated more effectively if the underlying mechanisms for cross-organ sensitization between the bladder and the prostate can be clarified. As a conclusion, the present study shows that chronic pelvic pain syndrome has distinct and negative effects on normal contractile function and compliance of urinary bladder, giving rise to a state of overactivity and signs of bladder pain syndrome. Alterations occur both regarding afferent and efferent signaling, but further studies are required to clarify the potential underlying mechanisms for prostate-to-bladder cross-sensitization. Thank you very much for listening.